Domestic funding for emergency plans for HIV and AIDS relief. President William Ruto, while speaking in Nairobi during the 20th anniversary of the President's emergency plan for AIDS relief, said that funding has been a major setback in the fight against the disease. According to President William Ruto, the government has increased its financial injection into the HIV commodity pipeline by 1 billion shillings over the past 2 years to enable a smooth supply of emergency aid and relief.
The conversation that is going to ensue shortly in Kenya is how we are going to fund our health requirements sustainably. And the biggest thank you we can give to those who have supported us, like PEPFAR, is to figure out, as Kenyans, how we can deal with the challenge of financing, how those who are able can do more to support those who are not able.
He lauded the government's partnership with the United States of America through the U.S. PEPFAR, saying that it has helped save lives since its inception in 2004.
There have been fewer instances where such partnerships have translated into direct, personal, feasible transformation in the lives and well-being of people in terms of ending suffering, reducing the number of deaths, and prolonging the lives of millions of people who might otherwise have faced high risk of agonizing early death. Kenya's partnership with the United States of America through the U.S. President's Emergency Plan for AIDS Relief, PEPFAR, is one of these very rare partnerships.
PEPFAR aid, which committed more than $110 billion to the fight against HIV and AIDS in more than 50 countries globally, has saved over 25 million lives and many more HIV infection prevented in the country.
Today we celebrate 20 years of PEPFAR's impact in Kenya and, of course, to an extent also globally. Today we celebrate 20 years of hope. The stories that you've seen just now in the gallery walk is just 20 out of the millions of lives that have already been saved by PEPFAR.
Together, Kenya and the United States have altered the course of the HIV/AIDS epidemic in Kenya. The partnership has saved millions of lives, strengthened health systems and economic prosperity, and perhaps most importantly, created hope. With over 1 million Kenyans on daily life-saving HIV treatment, and 94% of them have successfully suppressed the virus, I can confidently say Kenya is on the cusp of epidemic control.
The president noted that with 1.4 million people living with HIV, over 48,000 children as well as 55,000 breastfeeding mothers are on HIV treatment, assuring that the government is committed to ending AIDS in children by 2027. All right, now